Hello, my well-being buddies. It's me, Steve, the mental health nurse, and today we're looking at suicidal thoughts, or commonly known in the business as suicidal ideation. So, a bit of disclosure, this is a tough topic. It can be emotive for some. However, if you are currently now watching this because you are having suicidal thoughts or in the process of completing suicide, I just want you to stop. I want you to ring the emergency services, and I want you to then come back and carry on watching so you've got a distraction. So just press pause, ring that emergency services and let them know how you're feeling. Equally, if this is an emotive subject, if you find it difficult, it's something that we need to discuss because we can't hide behind this uncomfortable feeling, because it's one of the reasons we have one of the highest suicide completion rates. And we want to make sure that actually we normalize this conversation so we can openly talk to people about how they're feeling and make sure that we're not putting any guesswork into this. I know this can be difficult. However, if you are uncomfortable with this, please make sure you get supervision afterwards or talk to somebody about some of the things that this may have brought up. So what we're going to cover then is what suicidal thinking is, what causes it, some of the risk factors, understand some of the signs and the suicidal thoughts, how it's assessed, some of the treatments, and then down at the bottom, any medication treatments that might be appropriate. So suicidal thinking really is the feeling like you want to die. And if you have that, it's important that you can manage that and that you have somebody to talk to. And I can talk openly about this subject because I've tried to complete suicide a couple of times in my younger days. And it was because I was going through trauma. It's because I went through a lot of things and I didn't see or feel a way out. And it was the only thing that I could do to escape from everything that was going on. Now we're a bit more open about it. Now we're encouraging people to talk, and now mental health services really are there to support you. So it's important to say there are lots of different organisations and charities there that can help with suicidal thinking. There's lots of phone lines. We've got Samaritans, we've got Calm, which is Campaign Against Living Miserably. There's Pyrus for people under the age of 35. There's Childline for children under the age of 19. There's the Mix for people under the age of 25. And there's an SOS called the Silence of Suicide for everyone. And that's done between 4 p.m. and midnight. There are online chat services here. So we've got Shout Crisis Text Line. There's Young Minds Crisis Text Lines. So there's a lot of people that we can text and talk to. And equally, we can talk to our GPs, or we can ring 111, or we can contact our local mental health crisis team. So if you're not sure where your local mental health crisis team is, if you Google it, I'm sure you'll find it quite quickly. What's important is if your life is in danger, or if you think somebody else is, then it's important to it's important to call 999 or your emergency service number. So what can we do for tips on coping right now? We'll try not to think about the future. Just focus on getting through now. Stay away from drugs and alcohol. They reduce our ability to think clearly. Get yourself to a safe place, and hopefully you've got some advanced decisions there. So somebody that you know that you can go to and people that you can be around. Be around people, don't be on your own. And try some things that you enjoy. So spending time with your pets or something else. And there's lots of tips online on distraction techniques. If you're worried about somebody else, again, there are tips online on how you can support people. But what the most thing you can do is you can ask an open-ended question, such as, how do you feel about this? Or how do you feel right now? Let's get talking. What we need to do is then look at a safety plan. So the safety plan, again, there's online organizations where you can get these from, and they will help you create things to do to distract your mind to manage this. And you'll be able to do that, hopefully. So as we move through then, what are suicide thoughts? So suicide thoughts are these images and thoughts of ending your life, and all you can think about is death. And the more we think about it, the more at risk we become. So it's that cognitive behavior cycle, thoughts, feelings, and behaviors. So what causes suicide thoughts? Gosh, it could be pretty much anything. Bereavement, loss, wanting to be with somebody else. It could be depression. It could be other mental health conditions. It could be being in a dark place, abuse, trauma, PTSD, post-traumatic stress disorder. It could be the fact that you don't feel listened to, that there's no way out, you see no other option. We have what's caused risk factors. We have preventative factors, and we have risk factors. So risk factors, we know, for example, people that have tried it in the past, it increases your risk. People with poor mental health, it increases your risk. People that use substances, it increases your risk. Men in between their 40s and 50s, it increases the risk. And we need to look at risk factors and decide, is this person more at risk? And that's not to say that that's the only tool, but we should be using this and in a clinical observation, trying to ask those open-ended questions. And sometimes we just need to go in. So how do we assess risk and what are the signs? So signs could be somebody is writing letters, somebody is giving away their possessions, somebody who was once sad now all of a sudden seems cured and well and happy. And that's because they've got a strategy in their head, they've got a way out. It might be the fact that you found images on their website. It may be the fact that they're talking, or it may be the fact that just the way that they're talking hasn't got a future to it. So you can't hear any future plans. So if you're not getting those future plans, if you're thinking that this person's got a history here, their risk factor is heightened, your alerts should be up, and we should be much more on guard. So how do we assess it? Well, it's done through a clinical interview. Again, we're going to ask the question, and the question is this: are you thinking of killing yourself? They say yes. The next question is, do you have any plans? Because if we don't ask that question, we're not going to know. The evidence shows there is no increased risk of suicide or somebody completing suicide because of asking those questions. Actually, it decreases the risk because you are now inside somebody's mind. You've got that connection and you've understood. So when we assess it, we're looking for the way that somebody's talking, the way that they're acting, and the way that they're behaving. And we use those protective factors to weigh up our decision. Ultimately, if somebody tells you they've got a plan, they've got a method, they've got a means, they've put too much thought into this. That's more than somebody just getting themselves ready. If they're giving away their possessions, if they've written letters, they are going to be at high risk of completing. Now, ultimately, a lot of people say to me, but Steve, I know people that have done it and there were no signs. And the thing is, they probably are. They're just very subtle and you need to be looking. And it's those turning points. And in a turning point, you're looking for positive comments. So are they looking at a future? Is it bright or is it all doom and gloom? And ultimately, we're going to weigh what they're telling us up. We shouldn't just be using one assessment tool. And what the National Institute of Care of Excellence says is we must use a combined approach. So we must use those questioning skills. If we think somebody is at risk of suicide, then we're going to stay with them. We're going to create that safety plan and we're going to get them the help that they need. If somebody is in the process of completing suicide, then we're obviously going to do our emergency first aid protocols, maintain airways, get them on the floor in the recovery position, or if they've self-injured through cutting, we're going to be applying direct pressure and raising the injured parts. If there's a suicide attempt with medication or poisoning, we want to try and gather that evidence up for the emergency services. So bottles, evidence, and if there is vomit, if you can try and collect some of that, because that could go for analysis to help. It can be incredibly distressing. So the self-care bit is really important here. Making sure that you've got somebody to go to, somebody to talk about your feelings is really important. And again, those organizations are there for you as well. So how do we treat this? Well, we need to teach new coping skills, new emotional resilience, and we need to look at some of the triggers. And that involves some root cause analysis work. Why are we thinking like this? And then maybe treating the triggers, and that will resolve some of this negative thinking. A lot of it could be because of stress and being overwhelmed, the thought of being homeless, the thought of having no money, the thought of having no food. So again, trying to show somebody that there's help and support out there. There's food banks and organisations and charities. There's an opportunity to have your bills reviewed and lots of things done there. So just a bit of social prescribing might be the way forward to help manage this naturally. Equally, if you are having these thoughts on a long-term basis, maybe your GP could treat you for depression and that piece of low mood and anxiety, or alternatively, they may do a referral to psychiatry, and that might be for mood stabilizer medication. And again, that would be managed by them and they would come back. And obviously you'd be supported in those. So let's just summarize this. Suicidal thinking or suicidal ideation is that constant thinking. And it's important to say, we have all thought in our lives at some point or another, I'd be better off dead. They're thoughts. We're not holding them. They should come and they should go. It's when you're holding that thought, or that thought is continuous and you can't let that thought go. That's where it becomes a problem. The cause of those triggers: social, emotional, relationship, loss of protective factors will trigger somebody's risk. The risk factors there, if somebody has a less amount of protective factors, they're more at risk. If they've got a history, if they've got substance misuse, if they've got mental health, if they're male, they're more at risk. The signs then there: negative talking, no look of hope or light, no future planning, giving away possessions, telling you, they may tell you, that could be an absolute sign. The way that you're going to manage that through assessment is ask them. You are going to ask this question: are you suicidal? Do you have any suicidal thoughts? And if they say yes, what are they? How often are you having them? And do you have a plan? If the answer is yes, can you keep yourself safe? If the answer is no, then we're going to call the emergency service. But if they say they can keep themselves safe, then you might want to create a safety plan and be with them until this intense feeling passes. Treatment then there: cognitive behavior therapy, dialect behavior therapy, could be some trauma-based stuff, or social prescribing, looking at what the actual triggers are. And if none of that works, then again, we're just going to be moving down to psychiatry medications to help manage this. I hope you found that session useful. I hope it lifts some of the worries around suicidal thinking. And just remember, everybody has a story, and it's the story that needs to be heard. And if you listen to that story in a non-judgmental way, and you allow people to talk, and you do that signposting, then hopefully you will have saved somebody's life. Anyway, I'm Steve, the mental health nurse, and thanks for watching.